Hello, I'm Sarah Davies. I'm Associate Professor of International Relations at the Centre for Governance and Public Policy at the School of Government and International Relations at Griffith University. We felt that the article needed to be written at a particularly important time for two reasons. First of all, after the Ebola outbreak, there was a lot of discussion at the international level, particularly from the United Nations, about whether or not the World Health Organization had heeded the warnings that were initially coming out about the extent and devastation of the Ebola outbreak. And there have been two particularly important reviews internally within the United Nations system about the Ebola outbreak response and about how the United Nations system, particularly the World Health Organization, can better respond to public health emergencies in the future. There was the World Health Organization's own internal review on its response to the Ebola outbreak, and then there was also the United Nations Secretary General Ban Ki-moon's creation of a high-level panel report on global public health emergencies. And what we felt was particularly important about the United Nations Secretary General's report was a discussion about the fact that the experience of public health emergencies is different for women and men, and that gender equality needed to be taken into account when thinking about how that society was going to erect a response to such an emergency, and what important provisions needed to take into account women and men's different experience and different healthcare providing roles and different community roles in trying to respond to an outbreak and contain an outbreak. But the advice didn't go much beyond that. And so what we thought was important at this time was to think about, well, one of the areas that needed to be also discussed was how these public health advisories need to extend upon an already strong series of advice that had been given in the human rights institutions in the United Nations, particularly through the CEDAW, the Committee for the Elimination of Discrimination Against Women Committee, and their general recommendations on women and health, and also the Special Rapporteur on the right to health. These are two, there's a committee and there's an institutional office there that have issued important advice just in a recent number of years about women's health, healthcare provisions for women, that we felt could further extend the advice that could be issued during public health emergencies. So that's what we seek to address in the article. There's three areas that we hope to address through this article. The first one is to actually ask the question about where is gender in talking about public health emergencies. And this follows on from an article that was written by Sophie Harman at Queen's Mary University in London, who Belinda and I are engaging with on a regular basis now. And what we're all trying to think about now moving forward is when you're talking about public health emergencies and when you're talking about international advice and international responses to these events, to what extent do we need to take into account the particular situation in that local environment and understand the situation for women and men as a collective, and women healthcare workers and men healthcare workers, and how can we take into account whether or not those relationships can further advance risk outbreak communication. So are there particular roles, are there particular voices that need to be heard and prioritised during these outbreak emergencies to ensure the best response? And to what extent can international institutions have, if you like, a continued engagement on gender inequality and health in these countries to ensure that there is a baseline knowledge, if you like, about when these emergencies occur? What do we already know about these situations on the ground? The other area that I think is really important about this study is calling for, if you like, what had been established in the earlier times of the 2000s was this relationship between health policy, global health policy, and a human rights discourse. There's been a lot of talk about global health and global health security, and we understand why that has happened, or people refer to it as the securitization of health. And that's because there's been a belief that calling out global health situations as security threats, delivers political interests, delivers resources. But it could be argued that what the Ebola case revealed was that actually it doesn't necessarily trigger the actor's engagement and response that you would expect would happen. We've had 10 or so more years of the World Health Organization talking about global health security, and yet at this point of this outbreak it didn't really trigger that kind of awareness for at least now we think 6 months on, and that it was in a context where the World Health Organization had already been losing funding in this area. So I think part of this project is about actually saying that maybe our presumption that aligning health and security works may not necessarily be the case, and that maybe what we need to think about more is how governments and the international institutions have a responsibility to talk about health as an enduring responsibility. It's an enduring right of individuals. And so for me, this project is about bringing health and human rights back into conversation with each other, particularly in the area of health emergencies. And then the third area of study that I think is really important for this is it ties up with, for me, in the field of international relations, a discussion about human security. What is it that makes individuals insecure? What is it that makes their daily lives one where they don't feel safe and they don't feel secure from threats that affect their opportunity to thrive and to survive? And so for me, what this project does is talk about the intersectionality of gender, insecurity, health emergencies, and also political representation. And so for me, what this project potentially does is thinks about how we can tie these ideas together and start to promote policies that may reflect individual needs and ensure that there are institutions responding to those needs.